Hello, my name is Sonia Hollis and I'm a qualified nutritional therapist and nutrition consultant. Now, I work with clients on a one-to-one basis, helping them to improve their health through nutrition. As part of this role, I help to identify various root causes of their signs and symptoms so that we can then work through with a nutrition plan to help address these potential imbalances. Now, today's video, I wanted to talk about arthritis because I've been seeing a number of clients who have this condition. So I wanted to share some top tips on certain foods that you can include in your diet to help alleviate some of these potential signs and symptoms that you may be experiencing. Osteoarthritis is a type of arthritis associated with wear and tear of cartilage within the joints. It is commonly, but not exclusively, associated with the aging process. So under the age of 45 is more common in men, whereas over the age of 45 is more common in women. Now, by the time we get to 50, 80% of us may have symptoms associated with this type of arthritis, which often starts as stiffness within the joints in the hips, back, knees or other joints. And then over time, our joints become increasingly swollen and inflexible. Rheumatoid arthritis is an autoimmune condition which is triggered by genetics, a bacterial or viral component, or possibly environmental or lifestyle factors. About 80% of sufferers are women, and the body, for whatever reason, develops antibodies against its own tissue and then attacks the cartilage and connective tissue. And over time, the joints become inflamed and enlarged. Although inflammation is manifested within our joints, our overall gut health is incredibly important to help manage this. If we have a disturbed gut environment, so there's an imbalance of bacteria in there, this could lead to a bacterial infection, parasites, intestinal permeability, so leaky gut, allergies or intolerances. This could then lead to partially digested food proteins getting into the bloodstream along with other toxins and microbes, which then puts pressure on our detoxification system. Now, if our liver becomes overtaxed with this could then lead to further inflammation. So I work closely with clients on a one-to-one level to help support their detoxification pathways, and we can do this through nutrition. There is a big link between inflammation and how well our body responds to insulin, the hormone produced in the pancreas to help control our blood sugar levels. If your body is sensitive and has a reduced sensitivity to insulin, or you're diabetic, or if you have too much sugar or insulin within the blood cells, then this can be toxic, which can then trigger an inflammatory response. So learning to balance your blood sugar levels is key to managing your symptoms of arthritis. And you can do that by incorporating good quality protein at every meal or snack that you're having, increasing your non-starchy vegetables, and also look at your quality and quantity of starchy carbohydrates that you're eating. Now, all the clients that I work with who have inflammatory conditions or managing arthritis, I use a blood sugar balancing diet, which is a low GI diet. So it focuses on good whole foods, it keeps you fuller for longer, and also helps to manage your cravings. On many occasions, joint problems can be linked to inflammation and also sometimes with problems with our immune system with response to autoimmunity. Now, our body produces chemical agents within the body that helps to either switch on inflammation or reduce inflammation. Prostaglandins are one of these main chemicals, and these are the most easiest to manipulate with the diet. There are three types of prostaglandins. Types 1 and 3 are anti-inflammatory, and type 2 are pro-inflammatory, which increases inflammation and also promotes pain. Omega-6 fats can convert into either type 1 or type 2 of these prostaglandins. So eating a diet high in omega-6s, polyunsaturated animal fats from meat or dairy, particularly non-organic, can produce more of these less desirable type 2 prostaglandins. Sugar and insulin can also redirect the conversion of plant-based omega-6 fats down this pro-inflammatory pathway. Omega-3 fats, on the other hand, go down the route of the anti-inflammatory type 3 prostaglandin. So the omega-3 polyunsaturated fats can be found in foods such as walnuts, flax seeds, hemp, chia seeds, and also oily fish. The monounsaturated fats can be found in avocado and olive oil, and these are neutral and they're not involved in the inflammatory processes. So having the correct amount of the omega-3 fatty acids is really important for our clients who have arthritis and also any other inflammatory conditions. So make sure that you include in your diet, you've got your oily fish, you've got your salmon, you've got your flax and your chia seeds, and also nuts such as walnuts. Now, also when I work with clients, we do support a supplement program because it's very, very important to get the correct amount of the EPA and the DHA levels within your body, and you can do that with supplementation. Many people with inflammatory conditions also have allergies or intolerances, some of which may be due to leaky gut. Now, we discussed this before, where partly digested food proteins are able to get through the gut lining, which then triggers an allergic response. Some of the common offenders are dairy products, wheat, yeast, and gluten. So if you have arthritis or in fact any other inflammatory condition, it may be worthwhile you having a food intolerance test. So please just ask me for details. Well, that's it for today. I hope you found this video useful. On my blog, I've created an article which goes through in a little bit more detail about different foods that you can include in your diet to help with your arthritis symptoms. If you're wanting to work with me on a one-to-one basis and you want a detailed nutritional plan and supplement support program to go with it, then please do let me know. You're able to book an initial free 30-minute mini consultation where I can discuss with you some of your goals and also discuss some initial steps that you can take. Okay, take care, look after yourself, and speak to you soon. Bye bye.